right, so today at Clitridge Whole Body Healing, we have Dawn Phillips with us. She's been a patient of ours for a little over a month. However, she was a previous patient back in 2014 and has now come back into our office and into our lives, which has been a blessing. So Dawn, go ahead and give us your story. What brought you back and why?
Okay, what brought me back? Well, what brought me back was I was on the conventional side of medicine. That was basically leading me to nowhere. Just a little over a month ago, I was actually seen at MUSC for 3 times in 2 weeks for intestinal problems that I've carried throughout, pretty much throughout my lifetime, but in the last 8 years, it's gotten to the point where they were going to take my intestines out. I've battled this back and forth between doctors at MUSC, locally, and Duke University. So between being thrown back and forth to doctors, doctor visits, different medications, nothing was helping me. I would go to the doctor in pain, and I would leave in pain or in more pain than when I went in. So realization came to me a little over a month ago that I was basically told, would you like to start on a pain management program? In between time frame of trying to figure out when we're going to take your intestines out, what we're going to do if possibly you could have problems with your kidneys. That's creating a little bit of the problem as well. So I'm sorry, it's emotional.
You're
it's emotional
fine,
to
yeah.
go backwards because
Yeah.
I'm set on going forward. But I left that office visit that day with my mind made up that I'm taking control of my life back. I have a lot of faith in who guides me, and I prayed about it, and I was led back to Dr. Donna. So again, a little over a month ago, I was in so much pain from intestinal backup for months that I could barely even walk. I could barely get out of bed in a day's time. I was completely self-dependent on suppositories for a bowel movement since September of last year. I seen Dr. Donna the beginning of January, and within days I had completely I believe I have completely been drained of the toxins that were holding me back and were inside me. That's just touching a little bit of the problems that I have going on, because I'm basically from the top of my head to the toes of my, to the bottoms of my feet. I have an autoimmune disease as well. I had a total thyroidectomy in 2013, which when I had that taken out, my life completely turned upside down as well, on top of all the other things that were going on. So again, the conventional side of medication or medicine that I was dealing with, doctors that were textbook doctors. I was being hospitalized for weeks at a time with no diagnose that could basically send me home feeling better. I was leaving the hospital feeling worse than when I went in. Giving medications, prescriptions that weighed next to the problem, added heights and heights and heights of more problems, more symptoms, more side effects, to where again my life, I had no quality of life. When I came to see Dr. Donna again at the beginning of the year, I told her, if you can give me, sorry, if you can give me 10% of my life, quality of life back, that's all I was looking for, because I've already been told by the professionals, basically there's nothing more we can do for you. So I seen Dr. Donna, had my x-rays, was given the results of my x-rays. Dr. Donna talked to me about the things that can be done, the steps that we can take. within 24 hours after seeing Dr. Donna, the toxins started coming out of my body, literally coming out of my body. Again, I had my first bowel movement on my own that I'd had in 6 months' time. Wow. So for the first 48 hours, I'd say life wasn't good. But at the same time, opposed to the things that I had gone through daily, day in and day out, I knew life was getting better. And I knew that mindset, it's something that you have to continue yourself. You have to be obedient in listening and taking the step that your body's telling you to take. So there wasn't any, do I go back to see Dr. Donna, do I not? I'm here to see Dr. Donna, and I'm here to stay with Dr. Donna. I've started on PEMF treatments, and again, the quality and percentage of my life that I have gotten back is way beyond the 10% that I asked her for when I first seen her. At some points some days I've had 100% quality of life back during my days. And that's only been a little over 30 days. So my future, I see it, is going to be a bright one. You know, I'm not giving up on myself. Dr. Donna's not giving up on me, and I will never look back again to the conventional side of medicine. We've been given everything that we need to heal our bodies, and I've found that it all starts right here with Dr. Donna, and I'm going to be here for a while. So with that said, I'd like for y'all to check back in, you know, few months from now maybe, and I'll give you an update on where I'm at and what I'm doing.
That is awesome, and God, you were such a beautiful person, and the courage that you have to be told all of that, I couldn't imagine. And how many people are out there in the same situation that feel like there's nothing else for me and give up.
Absolutely.
But you're giving them a hope, and you've given me hope, you know, and so that's awesome. And previously we were talking, and you had made the comment about what's on the inside. Elaborate a little bit more into that as far as what people don't know, and, you know, having what's going on the inside, but having that facade on the outside.
Well, it's kind of like, and everybody's different. So it's not that we beat down people that take the medications that they're given, because it's part of the world, and unfortunately, our minds train us that way, that we become part of the world. So we all look at each other that, well, you look good. If I had a penny for every time I've ever been told that, just during the last 8 years, 10 years that I have been really, really fighting hard for my life, I'd be a really rich woman. We just have to understand with each other that what's on the inside is not always what we portray on the outside. And that somebody can be going through the worst imaginable pain, and just because we don't wear it on our shoulder for everybody to see doesn't mean we're not experiencing it. And unfortunately, the conventional side of medication, that's what they go by. I've been to the ER many, many times, and because I'm not crawling into the ER, and because I'm not almost on my deathbed,
Right.
I'm not being treated equally. I'm not being treated the same as if there was basically something on the outside showing. I know I'm not going to make this long. I'm going to give it for instance, I was at the ER one time, and I hate to call him out, but I was with my husband, and I just refused to give in to the pain. I refused to give in to letting it have control over me. But I was at the ER because it had gotten to that over the scale, pain scale threshold. And a doctor came in, and of course, the first thing they ask is, how are you? What can I do for you? And of course, after you sat for 8-10 hours in the middle of the ER waiting to be seen, you just let me tell you. But I was told, again, sorry. Well, maybe if you quit smiling and don't look so happy when they come in to see you, they'll take you seriously. And there was no harm in it. There was, he meant no harm to me by saying it. But it was realization. It was, I think it was realization for everybody, that is the way we are portrayed. Just because they have degrees, just because they're smart, just because they wear the jackets. In a lot of cases, that's how we're portrayed, by the way we look and the way we carry ourselves. And in my case, again, I refuse to let the negativity, I refuse to let the devil have control over me in that aspect. So if I can still smile, I'm going to smile.
Amen.
If I can walk in, I'm going to walk in. So, again, that's just something, a realization that hit me, and I had a choice to make. Do I become negative over being sick, so that people won't believe me? And that's unfortunate. Or do I continue to be happy on the inside and the outside, knowing that there's something wrong, and just keep searching till I find what I need to cure me. For me, a lot of it's my faith. A lot of it's my guidance. I know who guides me, and I know who leads me. And it was when I started putting my trust in man that I backslid. I went downhill. So again, I had to surrender it all to my Lord and ask to guide me. And he did. And I've been led back to Dr. Donna. And again, here we are a little over 30 days. And I've got a smile on my face, and I'm going to keep my smile on my face. And I can't wait. I just can't wait to see what my future holds and where it leads me. So, again, if I had, to your question, if we could all just step up to look at each other as to what could possibly be going on the inside, and not so much focus on what somebody looks like on the outside, we could all help each other so much more. So again, I'd like for everybody to check back in a couple of months, and I'd be more than happy to show you how much better I am and how much better you can be too.
Right. Oh, Dawn, that is awesome. And I'm so excited. I can't wait for the next video to post and to show everybody where you're at, for you, because you deserve that.
Thank you.
And you're welcome. And we're so glad that you're here. We're very blessed that you're here. And we appreciate you taking the time to get the word out as far as you're not alone out there, that we are here to help you. And that's what this office is all about. So thank you so much for your time.
Thank you.
You're welcome.